The last 2 years of the COVID pandemic have taken their toll on many people, but perhaps most acutely on those who work in the health service. A recent survey of 10,000 NHS staff found that half are actively looking to leave their job, with 2/3 citing poor mental health as the main factor. Dame Claire Gerada is the President of the Royal College of General Practitioners and Chair of Drs in Distress. Great to see you on the programme this morning. How concerned should we be about the long-term impact on the mental health of our health practitioners?
Thank you, and good morning. Listen, it's difficult to answer that because, of course, anybody that's got mental health issues because of their work is worrying, and the figures that we're seeing from the surveys, but also from a service I run for doctors with mental illness, is showing that we're seeing a staggering increase in the number of people presenting with mental health problems. And what Drs in Distress has been doing over the pandemic is providing support groups for doctors, nurses, paramedics, in fact, for any healthcare staff. And we're actually calling on the government to fund for every single healthcare worker just 1 hour per month to help workers remain resilient, remain mentally well, by providing them with 1 hour per month for supervision, support, we can call it what we like, in order that we can actually keep people well and keep people in the workplace.
And of course, staff retention within the health service was an issue even before we went into the pandemic. I mean, when we're talking about, perhaps as many as 1 in 10 posts within the health service vacant at the moment, any further exodus of staff from the front line of the NHS really does start to put the quality of care into question.
Yes, and to be fair, the NHS has provided support for staff throughout the pandemic, and what the pandemic has done is shone a light on how important mental health and mental well-being is. But what we're asking for is that you don't have to put your hand up and say, I'm struggling, I need help, because those that need the help most are the most reluctant. We want this to be embedded within every single health worker's contract, paid for, time allocated to it, so it's there, and it becomes as normalised as, for example, I have to do continuing professional development, quite rightly, and this becomes as normalised. And yes, I mean, we've seen the pandemic has taken its toll on everybody. I think most people are feeling not as resilient and as mentally well as they were, say, before the pandemic, but healthcare staff have had to carry quite an enormous burden of the work, keeping us all well and keeping us as safe as possible.
I mean, it strikes me that even pre-pandemic, working in the health service, working in healthcare, is probably not one of the least stressful professions. So I'm wondering, to what extent, when people are training, when people are perhaps doing their clinical part of their training, to what extent are they briefed, are they warned, are they prepared for the mental stresses of working within the health service?
It doesn't form certainly didn't form part of my training. I don't think it forms part of a medical student's training. I think there is an increased awareness, but listen, nothing can prepare you for the fear, the anxiety of actually having to deal with sick people. And it is an anxiety-provoking place to work, but that's why we train, that's why we have such a long training. But what we're calling for, just as we've had physical personal protective equipment during the pandemic, I think we now need psychological PPE. We need to make sure that we start to look after, protect, support all NHS staff, because we've just seen the figures on recruitment and retention, and it's so important that we start somewhere and actually providing every single health worker with a space and time to reflect, to be together, to come together. It's sort of barn door obvious. And most people think, well, doesn't this happen anyway? If you're a nurse and you're having to deal with a ward and patient dying, or you're a paediatrician and having to tell parents that their baby's very, very unsick, that there aren't spaces where we can talk about that. But there isn't. And what we're calling for is that this becomes part and parcel of our contractual arrangement, that it's there for us to pick up without having to ask for it.
Psychological PPE, that's a great phrase, and one which I am about to steal. Dame Claire Gerada, thank you so much for joining us this morning. Appreciate your time.
Thank you, and thank you for all your hard work as well.
Oh, cheers. I'll take that. Thank you. Time for